Recently, there has been a rise in cases of misdiagnosis and medical negligence reported in Nigeria. Litigations, lawsuits are filed, but the deed has been done. There is no amends. The impact is irreversible. How do you know a case is negligent? What is the approach and how can it be prevented or resolved? This is our focus today on sound health. Good evening. Welcome to the show. I am Olas Bomudupe. The program continues in a moment. Joining us via Zoom to share his expertise on medical misdiagnosis is Damilare Adeoye, a medical lawyer and founder Medical Law Hub. Good evening, Damilare Adeoye, and thanks for joining us.
Thank you. I'm glad to be here, and I hope that I'm able to pass on the message to our listeners.
Many are in severe pains, paying for an error they did not bargain for. Why is there a rise in reports of misdiagnosis?
I can say that a lot of things, but majorly it comes to the system that we have in place in our health sector. One of it is the fact that we have laws that are not seen in action. What do I mean? It simply means that we have enough regulations and regulators, but to actually implement these laws are almost impossible because of the lack of infrastructure to carry these things out. So I would say that the lack of system from the government and also the fact that there is no proper infrastructure in our hospitals and trainees on different levels of all the professionals that work in these hospitals.
All right, is medical negligence the same as medical misdiagnosis?
No, not exactly. However, medical misdiagnosis can lead to medical negligence. What do I mean? A lot of people confuse medical misdiagnosis as negligence, which is simply a medical error. We've seen in many cases where in Nigeria, doctors are sued, hospitals are taken to court because of this issue. And when this happens, they fail in court to justify that it's negligence. Because not all medical errors, like medical misdiagnosis, fall under the canopy of medical negligence. To actually say something is medical negligence, it has to fulfill certain requirements. One of it is that there's a duty from the doctor or hospital to treat the patient, and the fact that there is also an harm in the situation and not just the duty. If the harm cannot be proven, then there is no point. It's just an error and cannot succeed in court. So also the condition that usually warrants a win for any patient in court or in any place is that you are able to prove this duty from the doctor, also that there is a breach of this duty in terms of the error itself, and that the error actually caused the harm you speak about. For instance, there is a common case in Nigeria that most lawyers know, which is Ojo against Garo, where it simply establishes that even though this doctor forgot a broken needle inside the patient, the fact that the doctor did everything to extract it shows that he has actually justified that it's just an error and not a negligence in itself. And the case failed. And people wonder why. And that simply means that they are not God. Doctors and hospitals are not God. They are expected to do what a reasonable person would do or expert would do in the circumstance. So for me, and in the legal sense, there is absolutely no exact connection, or it's not exactly the same to say medical diagnosis is a medical negligence. No, it's not the same.
All right, Damilare, thank you for that clarification. 70% of cancer cases in Nigeria are misdiagnosed. Another regular ailment is typhoid. Tell us, what is the effect of misdiagnosis if it happens?
So the effect itself, yes, the record speaks for itself. 70% is quite a big one. And like I said earlier, the system is not in place, the infrastructure is not in place to catch these things early. And from the right training to the infrastructure to regulations, everything needs to be compact. And for this to happen, we really need to be intentional as a country and ensure that we do everything we can to save lives intentionally, not just by what we say, but by what we do. And 70% is a big one. And cancer, as we all know, needs to be detected early for us to actually save the life of those who are affected. And if there is no proper system in place, there's a likelihood that it will be detected late and then makes it the case even more serious than it should be.
All right, how do you prove misdiagnosis and how should it be prevented or how should we prevent this from happening in the health sector?
All right. So misdiagnosis, like I said this earlier, it's a clinical error. So clinical error is not exactly the same as legal wrong. So for us to we cannot exactly take it off. We have to be honest because we always are humans and we always make mistakes. However, detecting when the right system is in place, we can always detect these issues early. Early detection of errors or misdiagnosis save life than working towards diagnosing rightly, because it is really hard to any professional, any medical professional will tell you that a lot of symptoms, illnesses have the same symptoms. And you can, for instance, we have a common virus out there now, antivirus, and it has almost the same thing as coronavirus. So how exactly do we ensure that we get the right diagnosis as hospitals and professionals? There has to be a follow-up. There has to be a system in place that actually checks the process. Maybe you need to keep people for certain period to ensure that as the symptoms keep coming out, you can always tackle them early enough before they become worse. So for me, I would say if we cannot always control the misdiagnosis, we can control the process so it doesn't get to a place where it is irretrievable or irreversible.
Okay.
Thank you.
All right, before we talk about seeking redress as a result of misdiagnosis, in Nigeria, many people self-medicate. We hardly go to the hospital, not just because hospitals are not accessible. Some cannot just afford services at the hospital. What must be done towards changing or achieving a behavioral change?
This comes down to creating the right awareness as well. As most Nigerians right now, they have low trust when it comes to the health system in the country, which is why a lot of people go on medical tourism, travel out to get treated. To really address this, we must pin it down to gaining the trust of the public by showing them we already have the laws, we have the regulations in place, the transparency must come on board. People must see there are a lot of good works going on in Nigeria, I must say. For instance, we have the Federal Competition and Consumer Protection Commission trying to really help people come forward and complain about lack of or substandard services provided by hospitals. And this will help build the public trust in that regard to be able to go more to the hospitals and get the right treatment. If the trust is not there, it's going to be the same. We always have to deal with situations where people want to self-medicate or even just, find another way, alternative to going to the hospital, and that would be bad for the country.
If anyone has been misdiagnosed, what is the way to go? How do you seek redress as a medical lawyer? And what is the way forward in all of this?
All right. So misdiagnosis, just like I said earlier, can lead to medical negligence, and it takes a medical lawyer, a medical law expert to actually differentiate this. And a lot of time, what we do, there are a lot of ways to go about it. I mentioned the FCC/PC, that's the Federal Competition and Consumer Protection Commission, and their duty is to ensure standards in our hospitals, to ensure that patient safety is of high priority. We also have the administrative route, which is through the professional bodies, and there is no medical professional in Nigeria, whether it is the nurse or the doctor, they all have regulatory bodies. Our main focus is always on the MDCN, which is the Medical, Dental, and
Cancer
Council of
Society.
Nigeria, and
Okay.
their duty is basically to ensure that the standard is not lowered. So when there's a problem, patients or victims of patients can seek redress administratively through that channel by uh, through affidavit to the MDCN. Another one, depending on the nature of the situation, because of course there are some that are just below standard practice. There are some that are really criminal in nature, what we usually call gross negligence, which is criminal in its nature. Of course, the states take up this situation. There was one in 2024 that I can remember vividly by the Lagos State government against one Dr. Oji, and because of the nature of the negligence, which was gross. When it is gross, it means that it caused bodily harm to the patient. And aside from the low standard of the treatment, it also caused certain bodily harm, if not death, to the patient. So if that occurs, there's a criminal route as well to actually prosecute such doctor or individuals, because of course we do know that we have people, so-called doctors, who are not qualified to practice in Nigeria. So such people can also be criminally liable and can be prosecuted in that sense. And then the last but not the least is the civil action that can be taken against such hospital or individuals as well. And a lot of people get that wrong a lot of times because they think you can just put a figure to it. And when it is ridiculous, it makes it hard, even as a medical lawyer, to, if for instance, I'm on the side of the doctor or the hospital, to say, here you're liable and you should sit down and negotiate the cost. But when the cost is ridiculous, then we still have to seek redress in the court. So the problem is not always that there are no ways to seek redress. The problem is always the nature of the redress that must be sought and the reality that the patient or the victims of the patient want to go through in achieving justice.
Okay. What if it involves loss of life? Have you seen or
Yes,
handled cases like that?
unfortunately, which is always sad to hear. I've represented certain clients before, and the question is always, if people don't die in the hospital, where should they die? So there are a lot of times, or few times, there are certain patients who all they actually require is palliative measures, meaning end of life care. And so if death occurs in such instance, could you still blame the hospital or the doctors? So we have to come with certain realities as well when it comes to death. As much as it is dreadful, we don't want to hear it. There are certain truth in it as well that we must deal with. So the problem is not that the patient died. It is whether what caused the death of the patient is it's due to the negligence of the doctor or hospital. So if, for instance, a patient died and we can see through the process that reasonable care, reasonable standard were followed through by the hospital and the doctor, then there shouldn't be any problem. But what we have seen in many cases is once there is death involved, nobody wants to hear anything. And there's this common saying by most victims or family of of the disease, where they would say, but she walked with her two
Two
legs into
legs
the
into the
hospital.
hospital.
How could she have died? No, they did something wrong, and that is not enough. Can you prove through the sequence, through the causation, that indeed they did not do what was expected of them as a hospital or as a doctor? If that is the case, and this is why what we usually do is we do a medical legal analysis of every case before we even reach a conclusion. We get experts on board. We say, okay, look at it from the time the patient entered the hospital. And most of the time, what we have realized, and this is more like a knock on our medical practitioners, is that they are bad when it comes to record keeping, which is one of the fundamental things they must do. And we also have a law that really provide for that, which is the National Health Act 2014, that you have to keep records, patient record intact, so that when issues come up, we can always look at the records and see whether you follow through with what is expected of you as the doctor or as a hospital.
All right, your final words as we wrap up now, Damilare.
Yeah, so uh, my hub, our hub, medical hub, one of the things we prioritize, which is our major objective, is awareness. And when we say awareness, we do not mean for just patients or Nigerians alone. We also mean for medical experts. What we have found out over the years is that what kills most people and why a lot of people end up in court unnecessarily is not because of anything but ignorance. It's either ignorance of the law or ignorance of what is expected of them as practitioners. And I want to urge all our listeners and everybody to actually try and know the basic rights of a patient. If you're on the patient side, know your right. It's, for instance, you can get the patient's bill of rights on the FCCPC website. That's the Federal Competition and Consumer Protection Commission. So you can at least know the basic things that you should know as a Nigerian that you can claim as your right. And also the physicians need to, I mean by physicians, I mean our doctors, our medical practitioners, they need to also know their responsibilities to the very last letter, so that when issues come up, they don't come to, they don't run scatter without knowing what to do. And because this is really very important, because what I realize is that a lot of our physicians, a lot of the medical practitioners in Nigeria, they are clinically brilliant. They are very good, competent clinically. But when it comes to medical legal issues, not so much. Not so much. So my encouragement to our physicians, hospitals, medical experts is that they need to start picking the regulations, the laws that affect them, so they can know their responsibilities in that sense. And of course, to our government, I would say that we need to build a more robust system to curtail or to reduce to the barest minimum medical errors, misdiagnosis in our system. Thank you.
Okay, good record keeping, know your right as a patient and caregiver, be committed, as well as having a regulated health sector. Damilare Adeoye, medical lawyer and founder, Medical Law Hub. Thank you so much for your time and expertise on sound.
My pleasure. Thank you too.
Right, Sound Health continues with trending health report from around the world. Please stay tuned. There is nothing absolutely wrong with seeking a second opinion, especially when it is about life and death, until investigations consistently lead to clear sanctions for professionals, institutions, and the public. The confidence in Nigeria's health sector or health system will continue to erode. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.